Gentlemen, if you are over 60, here is a question that may feel uncomfortable to ask. Have you ever reached orgasm, felt the usual pleasure, but noticed that little or no semen came out? For some men, it happens once and creates worry. For others, it happens again and again, but they say nothing. They wonder whether something is wrong with their body, whether their sexual health is declining, or whether this means they are somehow less of a man. That fear is understandable. But the first thing to know is this: orgasm and ejaculation are connected, but they are not exactly the same process. Orgasm is mainly the sensation of sexual climax involving the brain and nervous system. Ejaculation is the physical release of semen. Most of the time, they happen together so smoothly that we think of them as one event. But sometimes a man can still experience orgasm while releasing very little semen, or none at all. This is often described as a dry orgasm. And it does not automatically mean that your intimate life is ending. It also does not by itself diagnose low testosterone, infertility, prostate cancer, or another serious disease. What matters is understanding what changed, when it changed, and what else is happening in your body. So ask yourself 3 simple questions. Did this begin after a prostate or bladder procedure? Did it start after a new medicine or after the dose of a medicine was changed? And after orgasm, have you ever noticed that your urine looks unusually cloudy? These clues cannot diagnose the cause on their own, but they can point towards useful questions for a medical checkup. In this video, we are going to look at 3 important pathways that can lead to a dry orgasm. One involves semen traveling in the wrong direction. Another involves a change in the pathway or the organs that normally contribute fluid. And the third involves medicines, nerves, hormones, or other health factors that can affect the process. We will also separate the changes that usually need a routine medical checkup from the warning signs that should not be ignored. Age does change the body, but a change in ejaculation after 60 should not simply be dismissed as aging. Stay with me, because one of the most useful clues appears only after orgasm, and many men never realize what it may be telling them. The first pathway is called retrograde ejaculation. Normally, when you reach orgasm, a small ring of muscle at the opening of the bladder closes firmly. This helps direct semen forward through the urethra and out of the body. With retrograde ejaculation, that opening does not close properly. Instead of moving forward, some or most of the semen travels backwards into the bladder. The important point is that you may still feel orgasm normally. The change is mainly in where the semen goes. This is why some men are surprised when the pleasure feels familiar but little or no fluid appears. Now think back to one of the questions from the beginning. Have you ever noticed that your urine looks cloudy shortly after orgasm? That can happen because semen has mixed with urine inside the bladder. Cloudy urine does not prove retrograde ejaculation, but in the right situation, it can be a useful clue. Why does this happen? One common reason is treatment involving the prostate or bladder. Certain procedures can affect the bladder neck or the nerves and muscles that help it close during ejaculation. For some men, the change appears soon after treatment and is expected. For others, it becomes noticeable only later, when they realize their orgasms feel normal, but ejaculation has changed. Medicines can also play a role. Some drugs used for an enlarged prostate, high blood pressure, depression, or other conditions can interfere with the muscles and nerves involved in ejaculation. But this does not mean you should stop a medicine on your own. Stopping suddenly can create a different health problem. Instead, write down the medicines you take, including when each one was started or when the dose was changed, and discuss the timing with your healthcare professional. Imagine a man in his 60s who notices dry orgasms several weeks after starting treatment for urinary symptoms. He may immediately fear that his sexual function is disappearing, but when he understands that the medicine may be affecting the direction of ejaculation rather than his ability to feel pleasure, the situation becomes less frightening and much easier to discuss. Retrograde ejaculation is usually not painful or dangerous by itself. However, it can matter if fertility is important, and a new change still deserves proper evaluation. A healthcare professional may review your medical history, medicines, previous procedures, and symptoms. In some cases, a urine sample taken after orgasm may help show whether sperm are entering the bladder. That distinction matters because treatment depends on the cause. And not every man with reduced semen volume has the same problem or needs the same approach. So the practical step is simple. Do not judge your health by the amount of semen alone. Look at the timing. Look at your medicines. Look at any recent prostate or bladder treatment. And if the change is new, persistent, or worrying, get it checked. Sometimes the most reassuring answer comes from understanding not that the body has failed, but that the pathway has changed. The second pathway involves a blockage or structural change in the route semen normally follows. One possibility is an ejaculatory duct obstruction. These ducts are small passageways that help carry fluid from the seminal vesicles and other reproductive structures into the urethra. If one or both ducts become narrowed or blocked, semen volume may fall sharply, and in some cases, very little fluid may appear during orgasm. The causes can vary. Scar tissue from previous inflammation or infection may contribute. Small stones, cysts, or other structural changes can sometimes interfere with the passage. Some men notice discomfort during ejaculation. Others may see blood in the semen or notice that semen volume has gradually reduced over time. But here is an important point. Low semen volume does not automatically mean there is a blockage. That is why symptoms alone are not enough to diagnose the problem. If an obstruction is suspected, a healthcare professional may consider semen analysis, imaging, or other tests depending on the situation. Treatment also depends on the cause. Inflammation or infection may need medical treatment, while a confirmed structural obstruction may sometimes require a procedure. Now, there is another situation that many men misunderstand. What if there is no blockage at all? After certain prostate or pelvic treatments, the body may simply produce or release much less seminal fluid than before. For example, after radical prostatectomy, the prostate and seminal vesicles are removed, so most seminal fluid is no longer produced. A man may still experience orgasm, but no semen comes out. This is different from retrograde ejaculation. After prostate removal, the absence of semen is mainly related to the removal of the prostate and seminal vesicles, rather than semen being redirected into the bladder. That distinction really matters here. Imagine a man in his 60s who has had prostate surgery and later becomes alarmed because his orgasms are dry. If he assumes that something has gone wrong with his recovery, he may carry unnecessary fear. Understanding that the change may be an expected result of the treatment can remove a great deal of confusion. Pelvic radiation and other procedures can also affect ejaculation differently depending on the tissues and nerves involved. So the practical question is not simply, why is there no semen? Ask instead, what treatment, procedure, or change happened before this started? That timeline can be extremely useful during a proper medical checkup. And if the change is new without any obvious explanation, especially if there is pain, repeated blood in the semen, or other urinary symptoms, get it checked rather than guessing. If fertility still matters to you, mention this during the appointment, because the cause of dry orgasm can affect which tests and options are appropriate. If you find this useful, subscribe to Senior Health for more practical guidance on staying strong and independent after 60. Next, we need to look beyond the plumbing, because sometimes the pathway is open, but medicines, nerves, hormones, or other health conditions are changing the process. The third pathway looks beyond a blockage. Sometimes ejaculation changes because the signals controlling it are affected by medicines, nerve changes, or hormones. Some medicines can contribute to the retrograde ejaculation we discussed earlier, while others may affect ejaculation differently. That is why timing matters. If dry orgasm began after starting a new medicine or after the dose changed, mention that during your medical checkup. Medicines used for an enlarged prostate, blood pressure, depression, and other conditions can interfere with the muscles or nerve signals. But do not stop prescribed medicine on your own. A safer approach is to review it with your healthcare professional and ask whether an adjustment is appropriate. Nerve health is another important factor. Ejaculation depends on coordinated signals between the brain, spinal cord, pelvic nerves, glands, and muscles. Conditions that damage these nerves can disturb that coordination. Long-standing diabetes is one example because high blood sugar can damage nerves throughout the body. Neurological conditions such as multiple sclerosis or Parkinson's disease may also affect ejaculation. This does not mean that dry orgasm proves you have a neurological disease. It means nerve health is one possible part of the picture, especially when other symptoms are present. Hormones can matter as well. Low testosterone may be associated with reduced sexual desire, lower energy, erection changes, reduced muscle mass, and changes in sexual function. But a dry orgasm alone does not diagnose testosterone deficiency. And testosterone treatment should never be assumed to be the answer simply because semen volume has changed. If symptoms suggest a hormonal problem, blood testing and medical evaluation are needed before treatment is considered. Now, here is the point many men need to hear. Dry orgasm does not automatically mean prostate cancer. It does not tell you by itself what your fertility status is. It does not automatically mean low testosterone. And it does not mean that your ability to experience pleasure, closeness, or intimacy has disappeared. The real question is what changed before the symptom began. Was there a new medicine? A prostate procedure? Years of poorly controlled diabetes? A change in sexual desire, erections, energy, or strength? New numbness, weakness, or other neurological symptoms? These details help build a clearer picture and move you away from fear towards useful action. If the change is persistent, unexplained, or accompanied by other symptoms, arrange a medical checkup rather than trying to diagnose yourself online. Bring a list of your medicines and previous procedures. Mention when the change started. Describe any pain, urinary symptoms, blood numbness, or changes in sexual function. Sometimes the explanation is simple, sometimes it requires further testing. Either way, clear information is more useful than worry or assumptions. If you're still with me, type confidence in the comments. Understanding the cause is not about judging your masculinity. It is about protecting your health, your independence, and your confidence as you get older. And now comes the question, what should you do next? And which warning signs should never be ignored? Now let us turn everything into a clear plan you can use. First, look at the timeline. When did the change begin? Was it after a prostate or bladder procedure? Did it start after a new medicine or a dose change? Did it appear gradually or suddenly? Write down what you notice. A simple timeline can make a medical checkup much more useful. Second, review the other clues. Do you have cloudy urine after orgasm? Pain during ejaculation? Blood in the semen? New urinary problems? Changes in sexual desire, erections, energy, strength, or sensation? These details do not diagnose the cause, but they can help guide the next step. Third, do not change treatment on your own. If you suspect a medicine may be contributing, speak with your healthcare professional before stopping or adjusting it. If diabetes, blood pressure, or another long-term condition is poorly controlled, managing it well can support nerve, blood vessel, and overall sexual health. Fourth, get the change checked if it is new, persistent, progressive, or worrying. Evaluation may begin with your medical history, medicines, previous procedures, and a physical examination. Depending on the suspected cause, urine testing after orgasm, semen analysis, blood tests, or imaging may sometimes be considered. Remember the main message from this video, a dry orgasm can happen for different reasons. Semen may travel backwards into the bladder. The pathway may be narrowed or altered. A prostate or pelvic treatment may have changed how fluid is produced or released. Medicines, nerve problems, hormones, or other health conditions may also play a role. None of these possibilities should be diagnosed from a video alone. Most changes can be discussed during a routine medical checkup, especially if they are persistent. But seek urgent medical care if you develop severe pelvic pain, fever with significant pain, inability to pass urine, significant blood in the urine, or sudden new neurological symptoms such as marked weakness or loss of sensation. Do not let embarrassment keep you silent. Sexual health is part of overall health even after 60. If this video helped you, give it a like and share it with someone over 60 who may benefit from it. A change in ejaculation is not a measure of your masculinity. Understanding what changed, getting the right help, and protecting your health can help you move forward with greater confidence, clarity, and peace of mind in the years ahead.